This is a Quit Lit book review for Between Breaths by Elizabeth Vargas. For those who don't know, Elizabeth is an experienced and high-profile broadcast journalist. This influences her story and the reaction to it. Elizabeth starts her book with a not apology for writing it with relatively little sobriety. Professionally, I've come to dislike the term sobriety and even recovery because traditionally the treatment industry and mutual help position those terms as if those recovery and sobriety are lost with a relapse. I suppose that's a topic for another video, but I wanted to mention that I support her for sharing her story at any point she decides to share it. Elizabeth experienced several attempts at professional treatment before sobriety that allowed her to write this book. This is not uncommon, and it speaks to the aggressive nature of her alcohol use disorder and the anxiety and trauma behind it. I read all of the 1-star ratings on Amazon. Most of these ratings showed a lack of understanding of the negative synergy that when a co-occurring issue is on board, and instead framed her extensive discussion of her anxiety and panic and its history as blaming others. Many of the 3-star reviews, 3-star or less reviews, seemed angry that she is resourced and privileged. It makes me wonder if those reviewers would feel the same way if a celebrity author wrote about their experience with MS, cancer, or diabetes. I also saw in the reviews a lack of understanding of the needs, demands, and experiences of high-achieving, high-profile people. I see these needs in my clients a lot, and I think her book would be a useful resource for them for that reason. So here's my review. On the science of addiction, I gave this book 4 stars, primarily because if you read this book knowing the link between trauma, co-occurring, and addiction, her story and the content she shares is excellent. She doesn't talk much about alcohol itself in terms of the chemical nature, but there are other books that do, such as The Naked Mind or The Unexpected Joy of Being Sober. Science of Recovery, I gave her 3 stars. It was hard to rate this one because Elizabeth minimized, out of courtesy, I think, to AA's traditions, I'm guessing. She minimized her AA membership. Her primary mutual help seems to be AA. She does not endorse or suggest other mutual help. To be fair, though, she does not say anything negative about seeking other options. Additionally, she does talk about 2 very powerful habits, meditation and exercise, as an integral part of her personal recovery. Now that I'm saying this, maybe I should change my star rating, because dealing with stress is part of the science of recovery. She talks about her anxiety and stress management through her book in ways that are helpful and authentic. This was a difficult rating for me also because as a professional who has directed treatment, both residential and outpatient, I have some feelings and opinions about the treatment settings she described. Tools and tips, 3 stars. Elizabeth owns her story and does not directly offer tips and tools. She does share her experience, strength, and hope regarding her journey and what worked for her and what didn't. Equifinality, 3 stars. Elizabeth does not endorse multiple pathways, but does not make statements about them. She endorses a formal God, a Judeo-Christian one, and that's her story. There's a weird ending to the sobriety journey leading to her book that involved a person living with her in kind of a super sponsor role. I have feelings about this, but I don't really know enough about her experience with that to comment fairly. Relatability, quality of writing, and other factors. I gave this book 4 stars. I think Elizabeth's book is excellent for professionals and executives and the challenges they face in understanding their alcohol use disorder. I also think those suffering from anxiety or perhaps even other co-occurring disorders would benefit from her book. The bonus for me was it was a history review that is concurrent with my life. Writing this out landed me with less stars than I feel a book deserves. I think it has a needed place in the Quit Lit genre, and while the criticism I've read is less accurate about alcohol use disorder, treatment and recovery, and more about social and economic influences surrounding the author, combined with the lack of mental health and substance use disorder information.